Let's take a look at the article from the American Psychological Association on first responder mental health care, and presumably that includes behavioral health care in the substance use disorder care as well. So the purpose of the article is to critique systemic resources for first responders mental health care, to address their personal social characteristics, as well as workplace cultural stigma related to help-seeking attitudes, create a needs assessment for first responders' resilience, present 3 hypothetical vignettes that highlight different challenges that commonly affect first responders, and recommend interventions for those. Advocate for access to specialized resources that enhance first responders' preparedness for potentially traumatic events. So in other words, not just doing the post-traumatic stress disorder work, but helping our first responders be better psychologically and emotionally, mentally prepared for the trauma that they are inevitably going to witness. And I will tell you, it can, like I said, I've had the great honor and privilege of working with firefighters and paramedics. In fact, I even at the time of this recording, I actually have several in my among my clients, and the stories that they relay from work experiences are, they can be somewhat traumatic just hearing them. So we had some really heavy stuff that they are exposed to, not necessarily every single day, but they do relay circumstances that are hard to hear, let alone, imagining them experiencing it firsthand. And treatment that's culturally tailored to first responders' unique needs. Okay, so an estimated, just some data points about first responders. So at the time of this publication, 2018, an estimated 81,000 federal first responders have served Texas, Florida, Puerto Rico, and the Virgin Islands just in hurricane responses last year. First responders are susceptible to exposure to a wide variety of potentially traumatic events, or PTEs, that may affect their cognition, their emotions, and their behaviors. PTSD in first responders ranges from 8% to 32% compared to 7 to 8% and prevalence of PTSD among civilian Americans. And of course, that's would be no surprise that this number would be greater than this number because they are, as part of their job, exposed to quite a bit of trauma. Not to say that we aren't as social workers, for sure. So, we, in a sense, we as social workers can really be at higher risk for PTSD ourselves. Even just getting this stuff, helping people through this, in the aftermath, the emotional aftermath of these PTEs can be quite heavy, for sure. First responders also are at increased risk for developing acute stress, substance abuse well, I think it's supposed to be disorder there. Developing acute stress disorder, substance abuse disorder, substance use disorder, major depression, as well as vicarious traumatization, compassion fatigue, and burnout. Many first responders are volunteer or part-time, thus may experience limitations in varying workers' compensation and insurance coverage. So that was really, I hadn't even thought about that until I read this article, but many firefighters are volunteer. In fact, the firefighters I've worked with often volunteer in addition to their full-time job, because they have a passion for the work. But there can definitely be many of them who are not full-time employees and thus not able to access health insurance, at least through the fire department. So one of the things from an advocacy and policy macro standpoint is advocating for the offering of even for volunteers why not offer them health services? I mean, if we're relying on volunteers to supplement the workforce, the firefighter workforce, as well as the paramedic workforce, then wouldn't we want to offer them healthcare, because it's going to be, we need them, right? So anyway, so that's that slide. Erase this and move on to the next one here. Okay, oops. Come on. All right, there we go. Understanding the scarcity. So this is understanding the scarcity of access and resources. Decisions can be made by public policymakers, mental health professionals, government and community institutions on how best to attend to first responder healthcare. So, so we have a population, in this case, an occupational population, who are likely going to have a higher need. In fact, the data supports that they have a higher need, just from, at least from the PTSD data, for resources. Yet there's not often, or at least not historically, a corresponding reaction to that need of resources. In other words, they have the same problematic access that we all do to mental health services. I mean, I can't even imagine now, right, in our COVID world. So making sure that we recognize that this is a group that is going to need, likely need have more need for behavioral health services than the general civilian population. Providers need to be aware of the stereotype of superheroes who do not have needs for care, and that this is an underserved population. So it's kind of two statements within one there. One of the things that that can be a challenge, even if they do, have the opportunity to avail themselves of coming to you for treatment, is reluctance to kind of allow themselves to be vulnerable, because part of kind of, and I see it almost somewhat as a survival technique, is to have this kind of superhero mentality, meaning that, hey, I just go, and I hear this, I've heard this many times, hey, this is just my job, I go and do what I do. I can't be sensitive, I can't get choked up about these things because I got a job to do. If I'm choked up about it, I can't do my job. So, and in the moment, that is 100% true. And so, and in fact, it can be literally life or death in terms of their ability to perform their job. So I think we do have to be careful to not, not to inadvertently take away their defenses that they need in the moment, in a shift on the job, responding to a life or death, a call with life and death circumstances in the balance. But we want to help them, get that stuff out on the back end, and kind of getting that trauma out on the back end, and helping them with good self-care techniques to minimize the impact of the trauma that they're, like I said, inevitably exposed to. And so first responders, like the military, fear job discrimination and lack of confidentiality. And I absolutely, although I guess more recently, that I've, at least just on my micro level, there seems to be less of that among some of the younger clients who are firefighters and paramedics, seem to be more comfortable with it. So again, that's just purely anecdotal in my extremely small sample size. So to take that for what you will. So let's see, literature on military populations is often used to inform treatment for first responders, meaning civilian first responders, but the similarities between the two professions and their culture do not necessarily mean that the treatments will be equally relevant or effective. That's absolutely true. These are distinct cultures. There's a lot of overlap. And there's certainly, at least as far as police first responders go, there are a lot of folks who were in the military and veterans and pursue a civilian line of work in law enforcement. So, so there is overlap, but they are distinct.